There's a Mounjaro shortage in the UK, and there's panic buying going on as I speak. Let's get into it. First, I want to describe the situation of what's going on, why it's going on, then what you should do about it, and also what you should not do about it. So let's talk about what's going on. I'm the administrator of a Mounjaro support group on Facebook. We have over 24,000 members, free to join. Feel free to look it up and join us. But that keeps me on the pulse of what's going day to day in the world of Mounjaro. And I'm seeing a lot of people share online today that when they tried to place orders, they couldn't. Or orders that were supposed to come weren't coming. And so I was wondering, is this a overreaction by a few people, or is there a real issue going on? And I did some research and found that there are indeed credible reports of increased panic buying, supply strain, and rationing of Mounjaro in the UK right now. If you're not from the UK, this is still relevant because as we're going to discover here, as I discovered, there's a worldwide shortage and more people want to get on Mounjaro. So this problem that the UK is facing, it's already spreading to the US. I've got a video in the works about my problems ordering Mounjaro here, my problems with the insurance company, my problems with my local Walgreens pharmacy trying to get the order. We'll talk about this. I'm experiencing a low-grade version of the crisis that's emerging in the UK. All right, so first of all, what's going on, the shortage and the panic buying? Well, there's been a sharp surge in demand. As many of you probably know if you're watching this video, Trump's tariffs are going into effect September 1st. This is going to cause price increases of 170%. And so what people are doing is they're trying to double order if they can to try, because this medication is so expensive, they want to get additional Mounjaro before the price is up. The other thing I'm seeing people do is they're trying to order 15 milligram orders of Mounjaro, and then they'll kind of ration it out themselves. They'll order 15 milligrams per week, but then they're planning to do 2.5 milligrams per week or 5 milligrams per week, try to stretch that out. Many people think 5 milligrams is still a pretty effective dose, maybe not as effective as 15, but it's not a one-for-one trade-off as you move up. And so that they can order the max dose, but then have satisfactory results, maybe a little slower, but still significant at a lower dose, and they can save some money. They can lock in current prices rather than having to buy it at September prices. So there's reports Asda Online Doctor saw a 350% increase in orders. MedExpress saw a 40% increase. Provider Checkup even noted that they're getting inquiries about bulk purchases. People trying to find out, can they buy 6 months, 12 months supply right now at today's prices? So people are scrambling to take immediate action to try to mitigate the effects of this massive price increase. There is supply rationing going on. In response to all this, Eli Lilly is rationing the supply to pharmacies to try to manage demand. And that's even happening here. I went in, I'm supposed to be able to order the next dose, the next 4 weeks of Mounjaro after 20 days after my previous order. Well, you can do that, but they're not going to give you the drug until 2 days before you need to take it. So I thought I'd order it. I went in to get it. They said, well, no, it's too early. I was like, what are you talking about? Too early? Yeah, I ordered it past the 20 days. It was like a 3-day drama trying to get my Mounjaro. Fortunately, I got it, but it was, plane, trains, and automobiles driving around the Chicago area trying to get it. So one of the ways that Eli Lilly, the manufacturer, tries to constrain things is limits the amount of Mounjaro that's available to the pharmacies. The pharmacies then have to stack up the orders, fill them, from those who most need it. So if you're someone who's trying to come in 4 days before and not do it the last minute, the person who needs to take it today is going to get today's order because they're only going to get so many boxes of Mounjaro in. So supply rationing is going on. And then the National Pharmacy Association has described current demand for weight loss drugs, including Mounjaro, not limited to it, but including Mounjaro, as unsustainable, warning that rising usage may outstrip supply and push curious users towards risky, unregulated sources. So Eli Lilly simply cannot meet the growing demand for Mounjaro long term. And I don't know all the limitations of manufacturing and distribution. I don't know why they're not being more effective. It seems like they certainly are economically incented to do so. So I'm assuming there must be some limitations in the production process to put us in this situation, because I'm sure the greed motive is alive and well at Eli Lilly. But for whatever reason, they're not able to increase the supply in correlation to the rapid increase in demand. Which doses are hardest to find? High-dose pens are in short supply, and that's what I'm really seeing online in my Mounjaro support group. People who are trying to order 12.5 milligram doses, 15 milligrams, they're just not out there. And they're starting to send messages to each other of, where can I get a 15 milligram supply? And there just don't seem to be any available. There are more lower doses available, smaller doses such as 2.5 milligrams, 5 milligrams. That's what I'm on right now, although I'm thinking about moving up to 7.5 milligrams. And 10 milligrams remain generally more obtainable. So a little bit of good news there. So why it's happening? Why is there, this explosion of demand? There's just it's saying here, I'm looking at my research, especially GLP-1, GIP agonists like Mounjaro and Wegovy are in unprecedented demand. In April alone, 1.6 million packs were bought in Britain, mostly by private patients. Wow, that's only Britain. There's massive social media hype. I guess I'm part of that. I'm on YouTube. I've got a Facebook group of 24,000 people. And that's just multiplying the interest in Mounjaro faster than the manufacturers can meet the demand. Interesting. So the National Pharmacy Association is saying that, there's people who have a severe need for this medication. For example, I'm type 2 diabetic and have been for 10 years. This is one of the reasons it's so important to me. And it's possible the massive interest may start crowding out the people who really need this the most. So what can you do? All right. If there's panic buying, you've got to be on top of your game. You've got to be proactive. You've got to take action. So one, order as early as possible. So I have to do here, it's probably more so in the UK, I have to order early, and then I may spend 3 or 4 days following up each day. And I'm finding they'll say, well, maybe tomorrow it'll be in. Maybe tomorrow it ends. Well, it's in, but you're too early. And you're just going to have to keep pushing. until you find someone who's willing to help you. Communicate with pharmacies. That's important. I do understand how Walgreens kind of orders, at least here locally, and how the process works. I understand I'm not going to just walk in and pick up an order, most likely, unless I get really lucky. I've got to place the order in advance and then keep following up. It says here, discuss alternatives. And that may be something people are going to have to do. I tried Ozempic before. I had bad side effects. It didn't really suppress my appetite. Mounjaro for me is a whole nother level. Ozempic isn't really a replacement for me, but maybe if I had no other option, I would do that. And it says they're going to be prioritizing medical needs. So if you have a medical need that makes you priority, make sure that you are communicating that, okay? So those are the things you can do. What you can't do is start taking risk and ordering from unknown or disreputable sources. There's always going to be scammers who see this as an opportunity to make a buck and who don't care about your health, okay? So we cannot risk our health as the solution. We need to work the imperfect, broken system as best we can, as aggressively as we can, and let our representatives know that there's a big problem here. It's a medical problem, and it needs to be elevated and prioritized by our leaders in government. All right, hang in there, especially those of you in the UK or other parts of the world who are experiencing these severe shortages, dealing with panic buying. Be wise, keep your head, make smart choices, but be aggressive and get what you need. All right, I'll see you in the next one.